This video is for educational purposes only and does not replace medical advice from a qualified provider. Always follow your prescription label and pharmacy instructions. Craft Peptides does not endorse any specific medication or product shown. This video is provided solely for educational purposes. Some medications arrive as a powder and must be mixed with a sterile liquid called a diluent before use. Start by washing your hands and setting up a clean, dry workspace. Check the medication and diluent labels, confirm the expiration dates, and inspect both vials for damage. Wipe the rubber tops of both vials with an alcohol pad and let them air dry completely. Using a new sterile syringe, draw air into the syringe equal to the amount of diluent you need. Insert the needle into the diluent vial, push the air in, turn the vial upside down, and withdraw the prescribed amount of diluent. If you see large air bubbles, tap the syringe gently and push the air out until you're back at the correct mark. Next, insert the needle into the powder vial and slowly inject the diluent, aiming the liquid down the inside wall of the vial to reduce foaming. Remove the needle and dispose of it in a sharps container. Gently swirl the vial until the powder fully dissolves. Do not shake unless your pharmacy specifically tells you to. Check the mixed solution. If it looks cloudy, discolored, or has particles when it should be clear, do not use it. Contact your pharmacist or clinician. Label the vial with the date and time it was mixed if needed, and store it exactly as directed on your prescription label. Always use a new needle and syringe, and place all used sharps into a proper sharps container.